Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Right, Fiona, tell me what's going on with your feet. What happened?
Well, I'm not sure what caused it, but back last August, September, just all of a sudden, both feet, I started feeling like I had stuff in my shoe.
Okay.
Nothing in my shoe, and then I feel like I'm walking on lumps or pebbles,
Okay.
and then it got kind of worse, started really, got to a point where it was hurting and I was limping, and it was both feet, so I went to the doctor, they did x-rays, nothing there, so I went to a pediatrist and he thought that I had nerve trapped.
More to Neuroma?
Well, he didn't say that at first, he thought it was metatarsalgia. That's what he told me it was.
Okay.
Yeah. And so then, kind of I've been putting orthotics in my shoes, icing my feet, Advil, and then I've had custom orthotics in both feet, and then I've had a cortisone shot in each foot.
In each foot, okay.
So the pain is, especially the custom orthotics, is probably the thing that helped the most, but the shots really didn't. And so I've still got these issues in both feet, and
you still feel the lump there.
Yeah, I always feel like I'm walking on lumps.
Yeah, that's a sound like scar tissue.
Yeah.
So it was last September, October. Now it's in April, so it's about 6 months.
Yeah.
Okay. So what aggravates your symptoms now?
Walking too much on them, standing too much, especially being barefoot.
And barefoot. Okay. How much do you feel constant pain, or just your pain was weight bearing?
It's more weight bearing. It's more like the uncomfortable sensation of having the lumps in my feet, and my problem is I know how to not aggravate it, but then I can't do the things in life I want to do.
Okay. So you're not really having quality of life.
Yeah.
Yeah. Okay, so let's do the motion that aggravated. We'll have you walk back and forth and do hand raises and let me know how much pain with that.
Okay.
Okay. You are limping.
Yeah, because the left is hurting a bit more than it was when I came in.
Oh wow, sorry about that.
So it's about a 4 to 5 now.
4 or 5, just walking.
Yeah.
Oh, sorry. So let's do here.
And I'm not putting my palm on my foot.
You're not able to put, so it's worse.
Yeah. It's not while I'm doing them, it's when I come back down again.
How much?
So it's about the same.
5?
Yeah, that was sometimes
okay. And it's more on the
left is worse than the right. Yeah.
And how much on the right?
The right is like maybe a 2,
okay,
2
so
to 3.
It's worse.
This is a 4 to 5.
Okay. Are you comfortable lying your stomach? So your pain is mostly in here and here.
Yeah, on this one it's like kind of like right here.
Show me that again, I'm sorry.
It's kind of, on this foot it's kind of more aggravated, like right here.
And
this one is just like across the ball of my foot where you push.
Okay.
Yeah.
Okay, make sure whatever I'm doing is not painful, okay?
Okay.
So your left is worse. It's right in here. Sorry, don't kick me, okay? Alright. In here?
It's tender all where you're pushing.
Okay. But
yeah.
Yeah, okay. So in here. Okay. So we're gonna work on here. And you said your calf are tight. You feel this knot here?
Well, I do know you're pushing on it.
You feel that?
Yes.
That's a scar tissue.
Really?
Yes. Normally, it should feel like nice and smooth like here. You feel that? There is no knot. That's a scar tissue here. And you can, so here, you feel this? Okay. Make sure this is not painful. How does that feel?
It's okay.
Do you feel your calves are tight?
Yeah, quite a lot, yeah.
Do you wear high heels?
No.
Okay.
Never really did, and now I don't.
That's good. Okay. So you feel the knot is in Like you said, you feel like you're standing on a rock or not or something. Where do you feel it? It's just those spots
it's kind of across the ball of both my feet.
Both of them.
Yeah, but there's certain points that are more painful, like where yeah.
So we'll see if you can tolerate this. If not, we'll do something else. Okay. Is that too much?
That's okay.
How's that?
That hurts a little
Sorry,
bit, but I can handle it.
Make sure it's not painful, okay? Because if you have inflammation and we push the pain, that will make it more inflamed. We don't want that, okay? But this is the area that's very sensitive, yeah? What about now here?
That's okay.
It's okay? Okay. Here's fine? You have another knot here, you feel that?
Well, I do when you put it on it, yeah.
Yep, that's a scar tissue.
Didn't know I had it.
Yeah. That's what makes your calf very tight, actually. If it's a mild inflammation, you're gonna feel better, and I will be able to really dig in more. Okay? Any seizures? Pacemaker?
No.
Okay. Okay. Let me see if we can go deeper here. How does it feel now?
It's fine.
So it's not as sensitive as before? Okay. I'm gonna actually show you the scar tissue here. So it's gonna, you feel how nice and smooth in here compared to this?
Yeah.
Oh, okay, sorry. So you feel that bumpy area?
Yes.
That's a scar tissue. Your muscle should feel nice and smooth like this. This is not perfect, it's still grinding. And this is grinding. You hear that?
Yeah.
It's all scar tissue. It should feel like nice and smooth like this spot. You know? So that's the way we know the scar tissue. Is it sensitive or what's going on?
No, well it is a little, I mean it's not like...
Or painful? You hear that grinding?
Yes.
Yeah, that's all scar tissue here. Feel that?
Yeah, I hear it.
Is it painful? It's okay.
No, it's fine. I'm a little ticklish.
Okay, that's okay. It's fun to be here. Yeah, it's okay. Okay, think about something you like. What do you like?
Music, chocolate,
Nice.
wine.
I know chocolate gonna come. Yeah, chocolate is good. Music is good. What genre do you like?
I like most kinds of music. I just like listening to music. Kind of alternative rock, but I like everything from alternative rock to classical music. So.
Oh, that's nice. So variety of music, feeling.
Yeah.
Yeah. So you see, it's random in random
right
area, because it should feel like nice and smooth, like this. Feel that?
Yeah.
Yeah. Sorry. It's a little bit in here, because you said your calf is tight, and your calf gonna pull on your foot, and might cause. Is that too much here?
It's okay.
You see, this is not as bad as your plantar here. So you were limping very bad actually, and your gait, we're gonna work on how to walk the correct way. We'll go over this. Okay, I'm gonna walk.
Oh, that's weird. Okay.
What happened?
Well, I feel a little bit of a lump, but not like all the lumps that I've had.
It start to shrink?
Yeah, just a little bit on this
when
side.
we break the scar tissue, this is like shaving. So when we break it, you will start to see things shrink until we totally get rid of the rock. And that's exactly what you're explaining. You feel a lump, you feel a rock. That's a scar tissue. Just imagine you're standing on a rock. How it feel?
Mm-hmm.
Gonna irritate and inflame everything else.
Okay. Yeah, it's
Let's
good.
walk. Let's walk. You were limping very bad before. You still feel pain or it's gone?
It's a lot better. It's,
Zero
I still
to
feel a
10?
little bit in this side, you know, in that one spot. This one is, I'm not really feeling any pain here. I just feel a little lumpy, that's all.
Well, the lumpy is gonna take us a few sessions
but
to
it's less
totally
lumpy.
clear it up.
Yeah, but it's less lumpy.
So not the scar tissue is not my concern. My concern is your pain.
Yeah, so I just have a little bit left on this foot.
Where exactly?
That, like right, I would say like right here.
Right in there. Okay.
Okay.
Do you need this spot? I'm just joking. Is it too much?
No, it's okay.
And we're gonna let you do the hair raises again, okay?
Okay. I'm scared it's going to aggravate them again now that it's better.
Well, that's the way we test your response to the treatment.
Oh, okay.
If it's aggravated, that's mean you have inflammation. So I just want to make sure. Is it too much?
Yeah, it's kind of, yeah, just a little.
Okay, let me work a little bit more on that inflammation. And the tightness in the calf, when you walk, did you feel it or it was gone?
I didn't notice it.
Okay, that's
Didn't
good.
notice.
So let's walk and tell me how that feels. How's that?
It's better. I mean, I still feel it.
0 to 10. I'm talking about the pain. I know you're
So
gonna
on the,
continue
on the
feeling
left, I would say I'm about a 2 to 3. On the right, I'm a 0.
Okay. Do me a favor, because we're gonna show you how to walk. Okay. The problem I see, your arches are a little bit collapsing. So I will have you walk. Put your weight in your heel. Roll your feet out like this, and walk and tell me if you feel pain or not. And that's. I'll show you other stuff for walking.
Like that?
Yes. Do you feel it or no?
No.
Okay.
But I'm also kind of being protective of it too on the ball of my foot. But no, it's better walking like this.
Because this is a normal walk. Your arch is collapsing a little bit and you're putting weight where you're not supposed to put weight. If we don't correct this, you're going to continue injuring the area because think about if you're not walking the right way or you don't have good ergonomic, it's like you're building a house with the crooked foundation.
Mm-hmm.
So everything is crooked on the top. So we want to make sure to do it this way, the correct way. Because that's probably might be one of the risk factors of having this issue to begin with, because you're putting weight in the wrong spot.
Mm-hmm.
Let's try to walk again and tell me how that feels. We're gonna practice more the walking so it will be more natural.
Yeah, it's better than it was. Maybe it's like a 2 now.
Where?
On that one spot on the left.
In that spot. Yeah.
Nothing on the right anymore.
Okay. Let's try. Let's line your back. So it's underneath this.
It's like right here. That right where my finger is
Okay.
where it is.
Bend your knees. Man. Oh, this is the scar you said. Okay, so let me get a brief history of this. What's going on?
The ACL.
Yeah.
So I first injured at skiing,
Mm-hmm.
and then I tore my meniscus. So I had an ACL repair.
Mm-hmm.
Then I tore my meniscus and had a meniscus repair.
Wow.
And then my ACL, the original surgery failed,
Mm-hmm.
so I had to go get it redone.
Oh.
So there was about 10 years in between. And the last surgery on my knee was, it's been a while, it's like 2005.
Mm-hmm. Had a lot going on in this knee.
Yeah.
Yeah. Oh. And that's
It
the
hurts
foot.
there.
Sorry.
That's where they did the cortisone injection.
They did it on the top.
Yeah.
Okay, sorry.
Mhm.
Does it hurt while I'm doing this now? Or no?
It's a little sensitive.
Sorry.
It's just sensitive.
Okay. So you're not ready for me to give you another injection?
I don't ever want another injection if I don't have to
Okay.
have another injection.
Yeah. I don't blame you. I hate needles too. Is that too much?
It's okay.
So we'll have you walk the way I showed you, okay? That's the correct way. Because I don't want you to go back to do the bad way of walking to irritate it more. Okay?
So do my orthotics prevent me from doing that because they have arch support?
Hopefully if it's a good orthotic to get you... Yeah, it's fine.
So this will make me
hopefully
walk the right way?
To get you on the, your weight more away from that spot. Your weight should be on your heel, the low, heel,
And
3
out?
point, heel, out, and here.
Oh.
So your anatomy, you're kind of like putting more weight on the opposite side.
Yeah, like kind of going.
Yeah. So that will cause a lot of issue. You have a lot of scar tissue there. That means you cause strain on that area. You cause micro tear, all those lumps. So that's happened probably because, either, you were running or doing something and just putting too much weight on the area not supposed to be put weight on. Okay, I'm gonna do more magnet. Because you don't have much inflammation on the other side feel better.
Mm-hmm.
You have more inflammation on this spot.
Okay.
So that's the way we know how bad is your inflammation, is how fast you respond to the treatment. If it's mild with just the 2 magnets I have should be enough to get the mild inflammation down.
Mm-hmm.
But if it's moderate to severe, usually recommend patient they sleep with it, because you need more exposure to magnets to decrease the inflammation.
Hmm.
Okay, we'll have you drink a little bit more water and walk. Actually, let me do one more thing. How's that feel?
It's fine. It's a little tender over. It's a little tender, like right here. But it's okay. It's fine. I can tell it's tight there on the side.
Make sure it's not painful. Okay?
No, it's
if
not.
you feel pressure, you have more scar tissue here.
Yeah.
And this is the ankle you sprained.
No, that was that one.
The other one.
Yeah. Oh, I forgot. Yeah, I forgot. I remember. I had another injury on this side where I did something with my calf muscle and that ankle. Now I forgot about. I've been to PT so many times. I was running a race and it was a triathlon, but it was the end of the race. We had to run on sand. And it was soft sand, and at the end of the race my calf just completely cramped up. I had to crawl across the finish, and I was in PT for a while on that one too. That was that calf. And that
I feel a lot of scar tissue here. You feel that?
Yes.
Man,
yeah.
You're really...
I've had a few injuries.
Yeah. Good history. You hear that?
Uh-huh.
Yeah. Usually you don't get that scar tissue here unless you have bad injury. Bad injury most likely more than bad mechanics. But
I think that's what reminded me. I forgot about that time. Yeah, I couldn't walk after that race.
Yeah. Well. So let's actually drink a little bit more water, and we'll have you stand up and tell me how that feels.
Okay.
So when you walk, I want your weight in your heel and do heel toe walking.
Okay.
Okay, and outside more, not inside. So heel toe and walk on the outside a little bit. How's that?
Fine.
Your gait look much better. You're not limping like the first time.
Yeah, no, it feels a
Yeah,
lot better.
look much better.
It's better this time too.
Yeah.
Maybe 1, 0 to 1.
Let's do heel raises. And you can hold on the wall and tell me if you feel any pain. We're gonna count 2, 3, 4. Keep counting.
5, 6, 7, 8, 9, 10.
How does that feel?
Fine.
Okay,
Well.
10 more for me
13,
and 10 more for the cameraman.
16, 17, 18, 19, 20.
Are you trying to show off now?
Oh, I thought you wanted 30.
No. Yeah, well, that's fine. We did 20. The first time we did like what? It was not.
I don't know how many. I lost count.
Yeah. So you want to do 10 more?
I can if you want.
Okay. See that? That's nice.
4, 5, 6, 7, 8, 9. This calf is tensing up.
The calf, not the spot.
Yeah, right.
That's okay.
Right
we have
there, right there.
we have a scar
This is
tissue
fine.
to work
This
on.
is okay.
We have a scar tissue. So it might take us as long as the inflammation under control, it's just a few sessions to clean it up, because you still have the scar tissue. You will notice it start to shrink, but yeah. So how you feel?
Good.
What do you think about the ASTR treatment?
It's really interesting. It's kind
Because
of cool.
you had physical therapy
Yeah, I've had years of
for
it.
years. Yeah, can you tell
Yeah.
any difference
Yeah.
between what you had before and ASTR?
Yeah,
What's the
because
difference?
I think with the regular PT, I mean, sometimes it's kind of painful depending on how they're pushing and massaging me.
Mhm.
So it's sometimes a painful experience, especially
Mm-hmm.
when they have to, like my ACL, get my leg to bend again. It was really painful. But and other times they've really pushed.
Mhm.
And I think overall I do get back, but it takes a very, very long time.
Yeah. You
And
said
like I
one
wasn't
time
expecting.
We had 1 year of physical therapy.
Yeah, I've had
Wow.
multiple times of going for a year.
Yeah.
So I'm surprised at how quickly this
Mhm.
responded.
Yeah.
Yeah, and it wasn't so painful as PT.
Yeah. It was fun. You were tickled too. All right. Thank you
Yeah.
so much.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!